All right. Good morning, John. Good morning, everybody. So the coronavirus has forced popular tourist destinations to require extra health insurance coverage for travelers. Yes. So before booking your next international trip, okay, there are some very important questions you need to ask your health care insurance as well as your travel agent. Okay. Here to sort things out is Ben Tobin. He's from Brown & Brown Insurance of Nevada. Good morning, Ben. Thank you so much for being here. How are you?
I'm doing well, Monica. And you?
I am doing very good. And you know what? I think after our conversation, a lot of people might be canceling their trips or digging a little deeper in their pockets. So I was reading several articles online, and I thought, okay, this is a great topic. Countries are starting to force people to get extra coverage. First of all, why do they have to beef up their extra coverage before entering these countries? And how is that extra coverage going to be used in certain countries?
Sure. So a lot of the countries are requiring tourists to beef up their healthcare coverage, mainly due to the pandemic that we're currently in. Almost every country that is allowing visitors or tourists must apply for either a travel health visa or require a PCR test upon arrival to visit. The extra coverage is mainly used to ensure that while we are visiting or tourists are visiting those countries, we're not burdening those countries' medical facilities with medical costs due to tourism.
Okay, so I'm going to throw a scenario at you, okay? So through my research, I found that several popular destinations are part of this growing trend in our travel culture. They include Aruba, the Bahamas, the British Virgin Islands, Dubai, and Sri Lanka, just to name a few. And I'm sure, like you said, a bunch of them are going to be ramping up to this. So if I want to book a trip to, say, Aruba, and me and my family, me, my husband, and my son, we're already covered by, let's say, Blue Cross and Blue Shield. How should my pre-travel consult go, and with whom should I have the conversation? A travel agent, my healthcare provider, or both?
No, that's a great question, Monica. My recommendation is that you consult with your travel agent and your healthcare provider, depending on the country. If you end up with a medical emergency, the major medical carriers will expect you to pay that bill, get a copy of that bill, and submit that bill to them. They know it's in another language, and that's okay. But if you tend to travel, if your healthcare coverage plan does cover you internationally, you may want to consider buying a special medical travel policy. Much of the additional coverage available is supplemental, so it covers whatever expenses your health plan doesn't cover, such as deductibles. But you can also purchase primary coverage, which will allow to take care of your costs up to a certain amount. So just realize that your major medical coverage will cover you if you roll into the emergency room only. But if you get admitted, you're going to want to have that supplemental coverage, because that will pay for those additional nights that you might end up in those in that hospital system. Just realize, though, most of these travelers are going to third world countries, and their medical care facilities are not the greatest.
Yeah.
So these additional medical coverages also will extend to help you travel back to the United States for medical care if you need.
Good. Okay, so what if you're traveling with an elderly person, a special needs child, or you plan to do some rescue ventures? Now, I know I'm getting into the weeds here, but I know people in all of those categories, Ben, and they like to travel.
Sure. So if you're traveling with an elderly person or a child with special needs, I would recommend you buy the supplemental health insurance coverage. The insurance prices can vary widely, while with most packages costing between 6 to 12% of the total trip cost. Just realize that age is one of the biggest factors affecting the price. The rates will dramatically go up and down every decade over 50, while coverage is generally inexpensive or even free for children under 18. Now, caveat, some travel medical insurance policies won't cover expenses that result from activities such as mountain climbing, skydiving, or parasailing. If you plan to engage in activities, yes, if you plan to engage in those activities, work with a travel agent to compare adventure travel insurance plans versus just the regular medical health supplemental.
Stay your butt on the ground. Okay, how does the conversation shift? Now, this is near and dear to me because I'm a military wife. My husband did 21 years active duty in the Air Force. Military families like to travel. We're covered by TRICARE and have been for many, many years. How does that affect us if we want to travel internationally? How do we do that?
Yeah, great. So TRICARE, you are covered while traveling on business, vacation, or moving on TRICARE. The rules for getting care can depend on your plan and the travel destination. However, the best contact in case of emergency, and this is if you're going to the emergency room, is calling International SOS Medical Assistance, which is set up directly for TRICARE members.
Oh, wow. Are you kidding me? I never knew that, Ben. I'm so glad I'm talking to you today. Over 21 years. Are you kidding me? All right. And real quick, Ben, I'm almost out of time here. What about those, like, you have civic groups. Elderly people like to travel, and they are only covered by Medicare. What about them when it comes to international travel and health care coverage?
Yeah, so Medicare usually doesn't cover health care while you're traveling outside the U.S., Puerto Rico, the U.S. Virgin Islands, Guam, American Samoa, and the Northern Mariana Islands. I know, there's like very select. Consider part of the, that are all considered part of the U.S.
Okay.
There are some exceptions, including some cases where Medicare Part B may pay for services that you get on board a ship while in territorial waters adjoining the land of the U.S. So just realize that if the U.S. recognizes any place that you are going to, yes, Medicare will cover those particular areas. But again, always check the Medicare website and always consult with your travel agency.
All right, great information. Thank you so much, Ben. Our world has changed thanks to the pandemic, and thank you. We appreciate chatting with you today. All right, folks, there you have it. Make sure to just be a little more specific when you're traveling internationally. Don't forget to catch the MOJ Show Facebook Live tonight at 7 p.m. All right, Sherry?
My goodness, good information. Can I just say I'm glad I already parasailed.